Boston, a city steeped in American history and renowned for its academic institutions and cultural landmarks, holds a stark contradiction beneath its celebrated surface. While visitors and residents admire the beauty of its cobblestone streets, historic sites like the Freedom Trail, and world-class universities, a growing homelessness crisis paints a hidden, troubling picture that is often overlooked. Homelessness in Boston is a complex and deeply rooted social problem affecting thousands. In the midst of rising property values and booming real estate development, a significant segment of the city's population faces the daily struggle of finding safe shelter, food, and dignity. Each night, hundreds of men, women, and children sleep on sidewalks, in parks, under highway overpasses, and in emergency shelters, many of which are overcrowded and stretched beyond capacity. This hidden population contrasts sharply with the gleaming skylines and luxury condos that symbolize Boston's wealth. The causes behind Boston's homelessness crisis trace back to converging economic, social, and personal factors. One of the most direct drivers is the skyrocketing cost of housing. Rent prices in Boston are among the highest in the nation, with many working families and low-income individuals finding it impossible to afford a place to live. For someone earning minimum wage or living on a fixed income, even modest housing can consume more than half of their earnings, leaving little for other essentials like food, transportation, or medical care. The problem worsened following economic disruptions such as the COVID-19 pandemic, which led to widespread job losses and financial instability for many residents. When a sudden crisis, like job loss, illness, or family breakdown occurs, individuals often find themselves without the financial buffer needed to keep their homes. Limited savings and a lack of affordable options create a dangerous slide into homelessness. Once on the streets, individuals face an uphill battle to regain stability. This cycle is made even harsher by the inadequate supply of affordable housing. Waiting lists for government-subsidized housing facilities are long, in some cases years, while rental prices continue to surge, pushing vulnerable populations towards precarious living situations or depending on temporary shelters. Boston's homeless population is diverse, including young adults trying to find their footing, families struggling to keep their children safe, elderly individuals unable to cope with the costs, veterans battling physical and mental scars, and immigrants facing additional legal and language barriers. Each group brings unique needs and challenges to the problem, highlighting that homelessness is not a monolithic issue, but a deeply layered human crisis. Mental health and substance abuse are significant, yet often overlooked contributors to homelessness in Boston. Many individuals experiencing homelessness suffer from untreated mental illnesses, including severe depression, anxiety disorders, and post-traumatic stress. Unfortunately, stigma and insufficient resources prevent many from accessing effective treatment and support. Substance abuse, sometimes intertwined with mental health issues, can both lead to and result from homelessness, creating a vicious cycle that is extremely difficult to break. Effective intervention requires not just health care, but also long-term community outreach, counseling, and social connection. Another important factor is the erosion of traditional family structures. Breakdowns due to divorce, domestic violence, economic hardship, or generational poverty frequently leave young people without stable homes or guidance. These circumstances often push individuals onto the streets or into unstable housing arrangements, where they are exposed to further risks. For veterans returning to civilian life, challenges like PTSD, skill mismatches, and limited support exacerbate their vulnerability to homelessness. Immigrants, too, face language barriers, discrimination, and complicated legal situations that make accessing housing and employment more difficult. Boston has responded with a variety of social welfare programs designed to address both immediate needs and longer-term solutions. Emergency shelters provide crucial refuge from cold winters and dangerous street conditions, offering meals, hygiene facilities, medical services, and hope for a safer night. Mobile medical units travel to neighborhoods with high homelessness concentration to deliver care to those who cannot reach clinics or hospitals, addressing everything from wounds to chronic illnesses. One notable strategy gaining traction is the Housing First approach, which prioritizes placing homeless individuals into permanent housing before addressing other support needs. This model's premise is simple yet powerful. Stabilizing a person's living situation creates the foundation for better health outcomes, job re-entry, and social reintegration. While Housing First programs have shown significant promise and improved many lives, Boston still faces challenges scaling these efforts to meet demand. Limited funding, bureaucratic hurdles, and limited affordable housing stock slow progress, leaving many still homeless or cycling between unstable living arrangements. Vocational training and workforce development programs have become integral parts of Boston's efforts to help residents regain independence. These programs provide skills, training, education, and job placement opportunities tailored to local market needs. When successful, participants move from survival mode to becoming active contributors to the city's economy. However, economic volatility and rapid shifts in industries sometimes undermine these gains, requiring ongoing adaptability from both the programs and participants. The city also pushes for increasing affordable housing through incentives for developers, tax credits, and expedited permitting processes. Plans to create micro-apartments, co-housing communities, and renovated units aim to fill some of the housing gaps. But the scale of demand outpaces supply, and many live in substandard or temporary housing while hoping for more stable arrangements. Experts argue these efforts must be part of a broader, more comprehensive approach to be truly effective. This requires improved coordination among government agencies, nonprofits, healthcare providers, and community groups. A unified task force dedicated to homelessness can help optimize resources and target services more efficiently. Further reforms in zoning laws could enable more mixed-use and higher-density housing, bringing affordability to areas previously off-limits. Technological innovations also offer new hope. Digital platforms can map available housing, connect residents to services quickly, and reduce bureaucratic delays. Real-time data and transparent reporting increase accountability, enabling responsive, targeted interventions. Mental health support in particular needs a strategic overhaul. Community-based centers that blend professional care with peer support hold potential for more sustained healing and reintegration. Ensuring services are culturally sensitive and accessible is key to breaking the cycle of homelessness associated with untreated mental illnesses. Community spaces such as urban gardens and green areas improve mental well-being and social connection, offering healing environments that foster hope and resilience. Public awareness campaigns and ongoing community involvement can build empathy and keep homelessness a priority for policymakers and citizens alike. Stories from Boston's homeless population reveal extraordinary human resilience. Behind each statistic is a life disrupted by unforeseen crises, but also filled with dreams and courage. Many strive daily to reclaim dignity, build stability, and reconnect with the community. Boston's homelessness crisis serves as a profound reflection on urban inequality and systemic neglect. It challenges society to rethink what progress means and who is included. The city's future depends on embracing innovation, compassion, and coordinated action to ensure that everyone can have a safe, stable home. While the road ahead is difficult, Boston's mix of resources, community organizations, and potential for reform shines a light on a way forward. With commitment and empathy, the city can transform lives, honor human dignity, and become a model of inclusive urban renewal. Ultimately, homelessness in Boston is not just a policy problem but a call to humanity, reminding us to see those often invisible, hear their stories, and act to build a city where everyone belongs.